There's an often overlooked issue in cosmetic dentistry we need to talk about: the impact of porcelain veneers on speech. While they can create a perfect smile, porcelain veneers can also cause lisps and other speech issues. Let's dive into how these enhancements can affect your speech and why it's crucial to prioritize preserving your natural teeth. Porcelain veneers are custom-made shells of porcelain designed to bond to the front surface of the tooth to enhance their appearance. In addition to covering the front surface, porcelain veneers also extend underneath and behind the tooth by up to 10 to 30%, contrary to common beliefs. While they offer an aesthetically pleasing solution, the process of applying veneers involves altering the natural structure of the tooth, which can have unintended consequences. They cause irreversible damage to your teeth. If you're interested in learning more, visit www.beautybeyondveneers.com. The anatomy of speech and the role of teeth. Speech is a complex process that involves the coordinated effort of various parts of the mouth, including the teeth, tongue, lips, and palate. The teeth play a crucial role in the production of certain sounds, particularly those known as sibilants, such as es and z, and labiodental sounds such as f and v. Any alteration to the natural position or shape of the teeth can disrupt this delicate balance and lead to speech issues. So how do porcelain veneers really affect speech? First, let's discuss thickness and placement. Porcelain veneers add a layer of material to the front surface tooth. Even though this layer is described as thin, many people report that it actually feels quite thick and bulky, but it can alter the way the tongue interacts with the teeth, especially during the production of sibilant sounds, which we mentioned before, sounds of S and Z and F and B. The added thickness can cause the tongue to misplace or adjust its position, leading to a lisp. Secondly, one of the critical aspects of veneers is that they actually wrap under and behind the tooth. This is contrary to veneer marketing claims, statements from dentists, and the top-rated Google search for what are porcelain veneers, which describe them as custom-made shells that fit over the front surfaces of your teeth. Don't worry, we are here to provide the real facts that they just don't cover the front. This alteration can change the natural contour of the teeth, affecting how the tongue and teeth interact during speech. The tongue may have to navigate a slightly different path, which can result in speech distortions. Lastly, veneers often involve reshaping the natural teeth to ensure a proper fit. This reshaping can change the length and shape of the teeth, further complicating the natural speech patterns. Even minor changes can have a significant impact on the articulation of sounds. The psychological impact. Beyond the physical aspects, there is a significant psychological component to consider. Patients who develop a lisp after getting veneers often experience a decline in self-confidence. They might become overly aware and anxious about speaking, which can negatively impact their social interactions and overall quality of life. Considering the potential for these long-term psychological effects, it is important to reconsider the decision to choose porcelain veneers. Instead, one should opt for non-invasive alternatives which are reversible and have 100% no tooth drilling, which will be discussed later. Celebrities and speech changes. Many celebrities, once known for their normal to clear speech, have developed lisps or other speech issues after getting porcelain veneers. Notable examples include Gronk Daddy, the famous football player celebrated for his famous Gronk spike, developed a noticeable lisp following dental enhancements, as evident on his TV sports show. Carl Radke, a star of Summer House, Carl also experienced speech changes post-dental procedures, resulting in significant changes in his speech, including a pronounced lisp, as seen in the newer seasons of the show. Alex Rodriguez. The former baseball player and current sports analyst has been observed to have a lisp due to veneers, as seen on TV when demonstrating baseball swing techniques for youngsters. These are just a few examples, and if patients and celebrities were aware that they might potentially develop a lisp or speech issues, we strongly believe they would reconsider this procedure. Unfortunately, this information is often not disclosed. Non-invasive alternatives options. Advocating for alternatives that preserve the natural structure of the teeth, here are a few options. 1. Orthodontic treatments. Procedures such as braces or clear aligners can correct misalignment and gaps without altering the natural teeth. These treatments address the root cause of the issue rather than masking it. 2. Teeth whitening. For discoloration, professional teeth whitening treatments can be an effective solution. This approach enhances the appearance of the teeth without altering their structure. 3. Composite bonding. This less invasive procedure involves applying a tooth-colored resin to correct minor cosmetic issues. It requires minimal removal of tooth structure and can be a suitable alternative to veneers. To sum it up, while porcelain veneers can create a stunning smile, they come with the risk of causing lisps and other speech issues due to their impact on the natural structure of the teeth. Based on patient stories, expert insights, and extensive research, it is evident that non-invasive alternatives should be considered to maintain the integrity of the natural smile. By doing so, we can achieve both aesthetic and functional harmony, ensuring that individuals not only look good, but also feel confident in their ability to speak clearly and naturally.